You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, a new way to straighten teeth. They're called FastBraces, and even these clear aligners are available, or brackets. And with us, we've had him on the program before talking about replacing missing teeth with dental implants. He's here today to talk about this newest trend in dentistry. It's called FastBraces. Dr. Stephen McAnaney. Dr. McAnaney, welcome to the program. Welcome back, I should say.
Yeah, pleasure to be here, Randy.
Now, look, we've talked on the phone, and you're like really, really excited about these FastBraces.
I am really excited about the
love
fast.
it.
I love it. Real quick.
Okay.
I always hated braces. I mean, I didn't ever want to do them. I mean, that's one thing. I do everything but that. I sent it out and had the orthodontist do it until I found out about this. And a good friend of mine said, you ought to go see about this because it's incredible. And I said, oh, I don't want to. And he said, yeah, you should. So we made a bet, and I did. Okay. Right? So I did. I saw it.
What was the bet, by the way?
Well,
I bet you won't go, or
well,
I bet you'll like it once you go to the meeting?
I can't even remember. I don't know.
Okay.
It's one of those friend deals. Anyway,
Okay.
So anyway, I went and I found out about it. So I went back and I got all the training, and I saw how revolutionary it was. I'd never seen anything like it. I mean, it's literally faster, it's safer, it's better. It doesn't tip the tooth right, it moves the tooth and the bone. It does so many things for every age group you can think of. It not only straightens the teeth, but corrects disease problems that are happening as people get older and their teeth get crooked. There's so much science that went into this. You know, he's got 3 patents, only one has it.
So this is totally different than regular braces.
It is.
They just move the teeth slower in regular braces, orthodontics, and this just moves them faster? Is that what's happening?
Well, let me explain.
Okay.
If you saw them, I always say they look like braces. That's what they look like. It's all in the technology. So a lot of times we'll get into that, but it's the invention the guy made 25 years ago that spanned 50 countries now, and it's the way it applies force. It's a continuous force. Anyway, not to get into a lot of details, but it's quicker, hardly any discomfort at all, super fast, and of course less expensive. So instead of spending 2 years or 3 years or 4 years in braces, we're talking about 4 to 6 months, 8 months.
Some people you save in a couple of months.
Yeah, it's crazy. I mean, I just tell you it does, and it works, and I love it. Now I'm real compassionate about it because I see how it changes people so quick. So many people don't get braces. You know, teenagers do because it's a thing to do, and parents make them, I guess. But the kids do want it, believe it or not. And I'll tell you more. Yeah, I'll tell you about that.
That's one of the categories. First off, let's establish what are the categories of people that are coming in to do this, and then we'll go by one. So what are the categories of ortho patients that you're seeing?
So the big categories of ortho patients is your teenagers, young teenagers, your middle age, like your 45 to 55, like my age group, and then your people in their 70s and 80s.
They're getting this done?
Yeah.
You could be 80 and get braces.
Yeah, I've had it done. It's amazing.
Okay.
And I'll tell you more about it. So let's start with the teenagers.
Okay.
So I'm talking to parents right now because they might not know about what their teenagers' desires are. So I sat down with some of my teenager patients that are getting, matter of fact, they're loving it. They go to school, let me get this. They go to school, and with just like 4, 5, 6 weeks, their teeth are straight as or straighter than their schoolmates have been in theirs a year and a half already. So the schoolmates have been in a year and a half, say, hey, wait, what's going on here? I want out of mine, I want those, but that doesn't work, we don't do that.
Okay.
And so it's creating a little excitement and uproar because everybody wants it. Yeah.
Okay.
So what I found out, because I wanted to know, what is it, just because your parents tell you, or is it something they really want?
Okay.
I found out it's something they really want, and here's why. It's first of all, it's kind of like if you don't have braces, then everybody else has it, and it's just what you want, because it's one of those things that happens in school. If everybody has it, everybody else wants it. So it's kind of a status thing, first of all. But I dug deeper. I said, what is it about it? And so they tell me, when somebody tells me about that my teeth aren't straight, it makes me offended. It offends them.
And kids have told you this?
Yes.
Okay.
It makes them feel offended or not worthy or not good enough. And that affects the way they behave and the way they feel when they get around other friends or in their groups. And so it has a psychosocial impact on their life.
Okay.
It also goes deeper than that, maybe they don't go to study groups or this, that. It makes a huge difference in the way that young person develops. Matter of fact, in a lot of different ways from a psychological standpoint. And, it can cause them to have better grades, it causes them more outgoing, get on the
Because when you're in a better mood, feel better about yourself, you're going to perform better.
Yeah, you're going to perform better. You're getting involved in the different groups within the school, the cheerleaders or whatever it is. You want to be in it, and it's what's happening there. So it really has an impact. Now, when I was younger, if you had really, really bad teeth, yeah, but nowadays those kids' teeth don't have to be very off for it to make a huge impact. Where we used to just brush it off, little tiny problems with those teeth is everything about their image. Image is big. And now more than ever in schools, there's a lot of judgment going on. And it's not right. It's not right. We hear about bullying and all this stuff.
Like if you have a gap in front of your teeth or pointy canines or whatever. Yeah,
it's just not right. And it gives other kids, I asked the one girl, I said, okay, what if your teeth were crooked and none of your friends really cared? Would it still bother you? Because they don't care. And she said, yeah, it would. I said, why would it if nobody cared? She said, because I care. Okay. That was important to her, that she knew that her teeth looked as good as they could, because that had something to do with the way that her outward feelings and her outward expressions traveled, I guess.
So this FastBraces, that's the name of the company.
FastBraces.
This was designed by an orthodontist. Is that right?
Yes, Dr. Viazzi.
Okay.
And 25 years ago, it was an invention out there that was revolutionary. It still is. Everybody wants to copy him, but he has all these patents, so they can't.
So the orthodontist can't even do this.
You know what's
that right?
Yeah, that's an interesting story.
He edged him out or wouldn't allow him to come in?
Well, they didn't like it. But his story, and compressed, I don't know, I've heard it, but I can't repeat it. They didn't like it. Something happened there. There's a legal battle, and he won, and he said, okay, guess what? In the United States, orthodontists, guess what? You're out forever. Only trained general dentist can do it.
Can do the FastBraces.
And just last week or so, I got my master's level, so I'm a master provider, and it's great because, man, I just love doing this. I don't know which one comes first, teeth in today or the instant teeth replacement or this. I mean, they're both great because they're life-changing very quickly.
So to a parent, talking to the parents, at what point should they get their kids, their high schooler, involved in this? Like, what could they look for?
Well, they could look for any level of them being crowded or crooked or any spacing. Okay. It's very easy to spot. And the thing is, it doesn't get better. It just gets worse and worse and worse as the development goes forward. So those are just easy signs. Oftentimes the child or the teenager will recognize it before the parents. But but without addressing this, it's going to change their high school or their school experience because they're going to go through that.
So do you ask your child, are you happy about your teeth? Because it's a self-esteem issue. I mean, how do you even bring it up? How do they bring it up?
I don't know. But I would say so. If they see something, it's like, well, tell me about that. Are you happy with your teeth the way they are? I mean, just take a look. I mean, I noticed they're kind of crooked or some spaces. I mean, is that...
Because people will do anything for their kids if they can.
Yeah, they'll do braces for sure. Everything goes first for the kids. And so, yeah, maybe ask them a few questions to see if they want it. Now, one of the things the young girls told me, everybody wants braces in school because everybody else has them.
Okay.
Once they get them, she told me this, once they get them, they almost instantly want them off because they know they're in for a long haul.
Okay.
And now she's very, very straightened up in a short period of time, and she'll be out of theirs before they even start to get finished. So it's even more appealing. So she got them on, she's like everybody else, she gets her teeth straight and they're off. And so that's
so instead of 2 or 3 years in braces, you can get them in most cases under 6 months.
Yeah, 120 days, very commonly, right? 6 months, 8 months. I mean,
what if your teeth are really crooked?
Yeah, that's it. They're really crooked ones.
I mean, you could work with
It's amazing how quick it happens. It's beyond belief. I mean, maybe a year, and that's a really, really hard one.
Okay, now adults.
Oh, one other thing.
Yes.
One other thing about this is big. We don't have to pull teeth. A long time ago, orthodontists pulled teeth to get speed. Well, now, 20 years later,
make more room.
To make more room to pull the teeth in.
Okay.
So they get rid of teeth so they can straighten the teeth quicker. Now we see the effect of, a lot of moms know this, by the way. It decreases the facial structures. It makes you look like you weren't supposed to. Your DNA wants you, and it compresses your face. It causes headaches and it causes sleep apnea because it pulls it all in. We know that now. So pulling teeth just because to get faster results is not the thing to do. So with this, you don't have to do that.
You brought some photos. What are we looking at?
So these are some of my younger patients that are getting us some photos. Now this is.
And we're going to move to the adults too. You have photos of adults?
I have all the ones.
Okay, good.
Okay. So here's one young lady. that's has gotten started, and she's all excited because she knows what's going to happen. So this is in the beginning. We get started with the process, and they get excited for it. So take a closer look. She has this one high tooth way up there. That tooth's never going to come down on its own. It's always going to be. It bothered her. It's out there. It just looks wrong, and it messes up her smile and her presentation. Really pretty young lady, but she won't smile because of this thing up there. So her options were this: traditional braces, 2-3 years. She's in these braces for a long time, and she gets out maybe by the time she gets out of high school, or you ought to see how fast it's going. She's 2 months in or so, and it's almost finished. I mean, we just have a little bit to go. So easily within a side of a year, we're going to accomplish this, and then she can get on down the road. So this is a great young man. This is after he's finished. He's so happy. I mean, his happened so quickly. I mean, it's 6 months or less. He was totally, and his teeth were very, very crooked. I mean, in the past, before I found out about FastBraces, I would have never, he had gone to orthodontist, and it just, whatever happens, this is what happened. But now that we can straighten him a lot quicker with FastBraces, he's super happy. You can see his smile. He's very active. His teeth were very, very crooked, and he wasn't very happy about the way he came across to his friends and his groups that he was part of.
So how many months with him? Like 6 months?
6 months, yeah, 6 months. Somewhere between 4 and 6.
Okay.
It was very, very quick.
Now, there's an option where you could have clear brackets. Is that right?
You can have either. You can have clear brackets on the top or total metal. What we found is it's so quick, it doesn't really matter. But some people want the clear ones. They're a little bit more to get those as far as cost, but they're there. You can get whichever one. Oh, and nowadays, we even have the turbo and the super turbo. I'm not kidding you. That means it's super fast. So the traditional was fast. The turbo is what these kids have had. It's faster than the original design. Now they have a new one that's faster than that one. So it's getting faster with the new designs.
So if you're, now look, I know you don't want to go negative with any orthodontists because they do a great job. But would you say if you had your own child that had crooked teeth, you would go FastBraces over traditional ortho, in your opinion?
There's no doubt. Why would you? And here's why. Here's why you want to do it quick. Okay, if you get the same result, but it's quicker, less expensive, and it's less pain.
So this is less expensive than regular
less
orthodontics.
Discomfort, all this stuff. Now here's another big reason. Kids don't brush their teeth usually as well as they should anyway. You put these wires on there, that's worse. So what's the likelihood of you getting cavities because of those braces in the way over 2 or 3 years?
Good point. Okay.
So, and then you don't get the white spots for too much pressure. It's just a whole different story. It's hard to explain. I'm not sure I even still understand
so
if it works.
This technology is just completely different, the way you're moving the teeth than regular orthodontics.
It's in the bracket and the wire design. It's a patented bracket. So here's another one. This this lady's in her 20s, and this is after the fact. I mean, look at her smile. Before her teeth were really crooked, and she was not smiling, and she didn't really like. I don't know. It seemed like she was frustrated all the time. When she came to the office, I was like, oh, I didn't really know. There's really this nice person inside, but it was hard to get it out of her. But now with her straight teeth, actually she goes to the gym I go to, and I see her in there. She tells everybody, oh, there's my dentist that's straightening my teeth. Look.
That's nice.
She's so excited like a new person. It's great, and it happened very quickly.
You say it to parents that straightening your child's teeth sets them up for success. What do you mean by that?
What I mean by that is, well, like we talked about previously when we were all set, is that without your teeth being straight, first of all, it's what people see. It's how people form a judgment about a person within just a few seconds or like 1 or 2 minutes. It's not fair. It's just the way we work, I guess. It's the way our society is. So that's not fair, but it's real. The other part is it unlocks inside. If a person feels like they're restricted or feels like they don't look good enough, then they're not good enough. But when they look good and they feel free, it creates a freedom in them so they can really express themselves, not be held back by something they're embarrassed about.
So these little kids could be going through their whole high school without smiling. And they develop a different reputation, different identity.
Oh, it affects,
as a serious person or somebody that laughs and covers their mouth.
Yeah, it can affect their they can affect the way they get through, the way they feel about them, the way they develop mentally over the course of their high school or their junior high experience. It can keep them out of different things, or keep them out of groups of friends, or maybe keep them from running for student council.
If they become more introverted because of their teeth.
They form a prison around themselves that they need to get out of. but they don't know how, and the parents can help them with this, because if they can just get them started, and here again, with FastBraces, we've made it a much more affordable and much quicker, so it's a lot better.
Okay, you have more photos.
More photos. Now these are some adult patients.
All right.
That we have. I mean, look at this lady. Now this lady turned out awesome. I mean, she's more in my age group, and what a beautiful thing. Here again, her teeth were, you can see the spaces, the crowding. You know, when I say spaces, because of the crowding, her teeth are set back so it looks like you don't have a tooth. And so it just doesn't look right. And also, if you look at her face, the form of her lips and those types of things, they're kind of in because her mouth isn't developed. So in the lower teeth for her, we were able to straighten them out. Now, one of the things people don't realize when you get over 40 years old, you show much more of your bottom teeth, and that's all people look at. So getting those straight is very important. You'd be surprised, people come in wanting their top ones straight, whatever, but they don't think about the bottom ones. When I show them, I say, well, you know, you're kind of seeing these too, and then they realize it.
That's what you see when you're talking to somebody, is
they're
those
right
lower
there.
teeth.
Yeah. Now, the other complication, your teeth get crooked. They do this as you get older, and once they get a little crooked, they get worse. They don't ever get better. It compounds, like hitting a nail, and it starts to bend. Well, it never straightens out. It just gets worse. Well, that sets us up for a disease process. Now, it's identified as orthodontosis. It's a real disease. It's got a patent, this company, to fix that. So if you don't get that fixed, you're going to lose your front teeth. I see so many people lose their front.
So having crooked lower teeth,
you always lose those front
loss?
Yeah, it happens all the time.
Why?
Because they get crooked, you can't maintain them, you can't clean them, and you develop this disease process, which is a form of gum disease that eats away the bone. The bone's very thin right here. It goes away quick. And then now we have to come up with another solution.
So if it's just barely crooked on the bottom, that could be like a couple of months, straighten them out? 3 months?
Oh yeah, super fast. It's instant.
Because, you know, there's this movement, and we've had dentists on the program where they call it instant orthodontics, where they just say, just put veneers over those crooked teeth. Why is this a better idea than that?
Well, that's a good question. I do lots of veneers, and here's why I don't do that over ortho in a lot of cases. It doesn't solve the original problem. The problem is the teeth are crooked and they're overlapped. And if you do the veneers, you're going to have to mutilate the teeth or grind off the enamel to get them straight.
Carve down the teeth.
Carve down the teeth,
Okay.
and then you're forever indebted. Why? If you could straighten those teeth out and make them look nice without damaging them, it's better. Now, granted, I do a lot of veneers, but I don't like to do it then because it's better to do it the right way. The right way is to get the teeth back where they're supposed to be. That gets rid of the disease process.
And you could be, like you say, 60s, 70s, 80s to get orthodontics?
Exactly.
Really?
FastBraces.
But what if you've had your whole life crooked teeth and now you're in your 60s? Will this still work fast?
It still works fast on any age group.
Okay.
A lot of people don't believe that. Well, once I get older, my teeth are set, they won't move. That's absolutely wrong. They'll move just as easy when you're 80 as when you're 16. They just do. And the nice thing about the people my oldest patient that has done this so far is 79. It's a guy. And he came in and he knew he wanted it. I don't know, he found out about it and he wanted it and we did it. He's so excited because he wanted his teeth to be straight. He didn't want to have veneers and all those things. He just wanted his teeth straight, mainly because he couldn't clean them right. And he wanted to look pretty or look nice or look handsome.
All right,
That's the right word, right?
Okay.
So these people in these older age groups, we can't forget about them. Matter of fact, they're as viable. I mean, my mom's 76, and there's a lot of people in their 70s. They're as viable today as they were. It's almost like it's a whole new group of people, and they want to look nice and feel good. They want their teeth to be nice. They want to look pretty because they have a social life too. It's just different than the one that we have.
So you deal with a lot of people in your implant practice with teeth that you can't save. They have to be extracted. You get a brand new set of teeth with implants.
Yes.
But there's also a group, I guess, of 60, 70-year-olds. They have pretty good teeth, but they're crooked.
Yeah.
And this is good for that.
So you can do the
Could it
FastBraces.
still be like 4, 5, 6 months?
Yeah,
for
very
these people?
quick.
Okay.
So the thing is, if your teeth are terrible or you don't have them, they're just really messed up, do the transformation with the replacement teeth like we talked about on the other shows. But if they're good, just get them back to where they're supposed to be so you can live a healthy life on forward.
Get them straightened out.
Because once they get crooked, then they start wearing and wearing. They wear off because they're not where they should be. Then you have the disease process.
So crooked teeth end up getting worn down because they're not coming together properly.
In the wrong way, yeah.
Okay.
And then there's all sorts of things. Of course, now we know that the disease process associated with this is science. It's proven science. Those bacteria associated with this in older people have been linked to Alzheimer's and dementia as well. Okay. So there's a lot of disease prevention reasons to have your teeth straight.
So just much easier to clean when you have straight teeth.
Much easier to clean, yeah, and they don't get beat up. You can
So that
keep them
person,
longer.
that 79-year-old that did this, how long did it take and what do they say?
I think it was 6 months. It wasn't more, 6 or 7 months we were done. And they weren't just terribly crooked, but they were bad. And he was very excited. He was happy. Oh, that's another thing. These people in their 60s and 70s, I'll guarantee you. Now, let me tell you, this is I almost forgot.
Okay.
They will not wear braces traditionally. Won't do it. I'm not going through that. Well, here's what. Well, I might not live 4 years from now. I don't know. Well, they will, but they're not going to go through that long procedure. Now they found out there's a quick way. They're all over it.
So like in between cleanings, I mean, every cleaning is every 6 months. So in between cleanings, you could come back with straight teeth.
Yeah.
Is that right?
Yeah. But,
okay.
and actually more people in the older age groups are signing up for this because now they've been this way. They've wanted straight teeth for their whole life. And then now they realize there's a fast, safe, and easy way to do it. And they're doing it because of that.
So FastBraces. So ask for FastBraces. I mean, that's the trademark.
FastBraces. Yeah.
Okay.
Go online. It's FastBraces. They got their own logo. And then you can look up a dentist that does that. And they'll have all those
you're
people.
the master.
I'm the master in my area.
You have a master level? Is that what they call it?
Yeah. I've done that many, and they that's one nice thing about FastBraces. They don't just let you off on your own. They demand rigorous continuing education with their company, so you keep updated, because they're very serious about what they're doing in the world.
Now, what if I'm an orthodontist? Could they poo-poo this? Could they say, I don't like these FastBraces?
You know what? I know this is going on. I've heard stories, not from them, but from patients. It'll ruin my roots. It'll tear up my jawbone. It's got to be painful. How could their teeth move that quick and not hurt like crazy, or cause your teeth to fall out? All these things. You know, it's just not. It's fake news.
Okay.
It is.
Okay.
And the reason is that the design. It's a very subtle movement of the teeth, but it moves them very, very quickly.
You know, when an adult's wearing braces, they look younger. Don't you think?
Yeah. Well.
I mean, they just look younger with the braces on.
People are amazed. Why'd you get braces? Oh, that's pretty cool. And they get them off. That's another. I have a little interview with a lady. Everybody at her work said, "Wow, you got braces. Why'd you get them?" Well, she said, because I waited this long. I did my kids, and it's time for me. And then a short time later, she had them off. I said, well, "Where'd your braces go?" She said, "I'm done." I said, "There's no way. How could you be done already in 6 months? Didn't it normally take 2 or 3 years?" And then she got to tell him, "That's FastBraces."
Good. So you have a couple more photos
a couple
left.
more.
I don't want to rush it,
A
but
young guy. Look at him, man.
that's him smiling before?
Smiling before, and that's him after. Look how much more handsome and sophisticated he looks. He's a typical young teenager guy here. Now he looks like a businessman.
Yeah.
He's ready to go into business. He's ready to go do something worthwhile. He got rid of that hat, and he's got his look going on. This is another fella. He's in the military right now, serving our country, but he had really, really crooked teeth. And man, he just looks great now.
So there's two people in the photo. Are they both patients?
No, the one's my assistant. Actually,
Okay.
she's my FastBraces expert.
Okay.
She works with me. She's the genius behind the system. I mean, I'm there, but she's my main gal.
So 3 or 4 months or 6 months, this guy's got straight teeth.
Yeah, I think his was 6 months. I mean, 6 months is a good number. It can happen in 4 or 3. Never, I haven't seen one yet over a year. Yeah.
So if you have crooked teeth and you're watching this, what do you say?
Well, here's what I'd say. One of the things is it's astounding to people. They don't get it. So if you're looking to get your teeth straight with braces, I would suggest maybe going to a board-certified orthodontist specialist, okay?
Okay.
Let them look at you. Let them tell you what they should do or whatever. Make a recommendation. And then come see me and let me give you
a second opinion.
Get a second opinion with me on the FastBraces, and you decide. I mean, it really doesn't matter to me if you decide to do it with them.
Less expensive,
faster, less damage to your teeth, all the stuff. So I never have had anybody so far not go with FastBraces. It just makes logical sense. I don't know why you'd want to do it the hard way for more money, unless you just want to do that. I mean, I don't know.
Is that right? So it's a lot. Then you have financing available and things like that.
Financing. We got the same ones for everything else. Financing available.
You say as long as they have they don't even have to have good credit. As long as they have a driver's license or a photo ID and a debit card, you can get them approved up to $20,000. I know this doesn't cost $20,000.
Yeah,
but
it's huge.
That's big. As long as they have a good size down payment, like 30%.
Yeah,
you
but
can
this
do
doesn't
it.
cost
No credit check.
No credit check, and this doesn't cost much anyway. So the other part of it is, you know, new forms of orthodontics, especially the FastBraces, is changing the face of the way it's done everywhere. And so all those old ways, matter of fact, if orthodontists could do this, if the inventor would let them do it, they would be all over it. They're just, I mean, I feel bad for them because they can't. I mean, they're trying every way. You know, we mentioned about pulling teeth. We don't have to pull teeth. That's a big one. We don't have to pull teeth to do this. I mean, maybe 0.5%. Never.
So if your children, or even if you have a lot of crowding, you don't have to pull them with this technology.
And it's still fast. Your teeth aren't designed to pull out unnecessarily. You need them all.
Have you ever done any of your friends yet, or family?
My mother's doing it right now.
Your mother is
she's
in fast
76,
braces.
Right?
Is that
yeah.
right?
She's getting that crookedness at her. Now she has been years up in crooked. I said, Mom, you know, and she saw it. She said, actually, she said, I was scared to ask you. You know, I didn't know. I said, well, yeah, you need to do it. Let's go do it.
Your mother can't have crooked teeth, right? Certain states that's illegal for a dentist mother to have crooked teeth.
Well, I'm ashamed to say that it came to my observation that it was starting to get crooked. I don't know what happened, but she's having the same thing. It happened with women in her age group. They're starting to get crooked.
So what's she saying so far? I mean, is it as painful as everybody?
She got them on last week, so no, she loves them so far.
Is that right?
Yeah.
Before you know it, she'll, like 6 months from now, straight teeth.
Yeah, she'll be telling everybody.
And then easy to clean.
All the things, easy to clean, just everything. It's just, you know, straight teeth. Straight teeth were designed to be straight. It's outside effects that cause them to be crooked, or genetics, whatever. But straight teeth are important. You know, and then you get the side effect, they look beautiful. And the appearance, you know, it gets deeper than that. They're supposed to work right.
How deeper? Tell me.
Real deeper. I mean, they're supposed to, I mean, a crooked teeth lead to headaches. You know, 80% of women have headaches.
We're out of time. And final message, somebody watching this, they have crooked teeth. They don't really like the whole braces idea. Maybe this FastBraces sounds like a little bit better option. What do you say to them?
I would just say, give our office a call, come in. The worst thing that happens is you don't do it.
Okay.
I mean, I'm easy. Here's what I do with my patients.
Okay.
I just tell them, I'm your coach, I'm your advisor. Yeah, I'm a dentist, I do all this cool stuff. No judgment on you. I'm just there to show you what's possible, and if you decide to do it, great. If you don't, that's fine with me. But I believe that if you'll come and see about it and you learn more about it, it's going to be hard to say no because it's so great.
Okay, good.
I mean,
I want to thank you for coming on the show. Always a pleasure to have you on the program.
Yeah, thanks a lot.
Okay, good.
I love it out here.
They could go to the website. They could make an appointment there. They could see you face to face.
Website, go call the office. What do they need to do?
You're going to be the new king of FastBraces in your state.
Yeah, fastly rising.
Okay, good.
It's awesome.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.